Dear students, in this lecture I want to introduce you to the histological structure of the cartilage tissues. As you know, the large number of human tissues are divided into 4 major groups. This is what we name the basic tissues. 3 of them, the epithelial tissue, the muscular tissue, and the nervous tissue, is apparently made only of cells. In contrast, the connective and supportive tissues contains large quantities of substances between the cells, what we name intercellular substance, and this is what is not only present, but this is the most important component of the tissue. We do have cells which preparing and make a maintenance job on the intercellular substances, but why this tissue is really good for us is due to the intercellular substance. This is a kind of natural classification of the many components of the connective and supportive tissue, which is based on the most important parts of these tissues. As you know, connective and supportive tissues consist of cells and intercellular substance, which consists of visible components, these are the fibers, and invisible molecular level components, this is the interfibrous substance. Those tissues, tissue groups in which the fibers are dominating in the structure, the most important feature due to the fibers named connective tissue, and those tissues in which one component of the interfibrous substance is the key component which will give the final feature of the tissue named supportive tissues. The cartilage tissues, what I want to talk about that, belongs to this group because the ground substance is the most important component, and most of the features of the cartilage tissues is due to the presence of the abundant ground substance. We have 3 different types of cartilage tissues: hyaline cartilage, elastic, and collagen fiber cartilage. And the common feature of them, they have all identical cells, the so-called chondrocytes. The chondrocytes are round cells and with white cytoplasm. The white cytoplasm is due to the large quantities of proteoglycans present in the cytoplasm, which will be discharged later on to the intercellular substance. What do the chondrocytes do? The main task is when they are young, they are blast cells, they're producing in large quantities the intercellular substance, and when they are a little bit older, they reduce their activity and do the maintenance job, actually improving continuously the intercellular substance, but doing the same thing. The cartilage tissue consists of 2 major components: fibers, mostly collagen fibers, and proteoglycans. The synthesis of the collagen fibers happens in the very same way as it happened with the fibroblast. In some of the previous lectures, you heard details on that, so I don't want to repeat that. You remember this is a protein chain, and in the tropocollagen molecules outside of the cells, without any active influence of that, they set up to collagen fibers. The proteoglycans, as you know, you already had a lecture on that in details. They consist of a protein backbone and rich carbohydrate side chains. First is the protein backbone is made by the cells, of course, inside the glass surface endoplasmatic reticulum. And here the sugar will be added. Step by step the ribosomes go away, they become Golgi, and the further processing of the glucose molecules, the sulfation and amino addition happens here. Whenever the proteoglycans are ready, they, in form of secretory granules similar to that of the glands, will discharge in the environment. Then it happens the 3rd step of the intercellular substance production, which is independent of the activity of the cell. This is a kind of specific interaction between the proteoglycans and the fibers, which means the proteoglycans forms a jelly into which the fibers are glued in. Here you can see a pair of pictures, electron microscopic picture. The upper panel is a chondroblast. You know, the chondroblast, usually the cell ends with blast, a young cell, energetic cell, very actively producing whatever they produce. In this case, the intercellular substance, and the sites are the elderly cells, which reduces the activity and just doing slowly maintenance jobs and something like that. The chondroblasts, like the blast cells, has very active nucleus. You can see loose chromatin and a lot of rough surface endoplasmatic reticulum in the cytoplasm. You know that every biological features or components basically made of proteins or at least protein containing enzymes producing that. So the first step of doing anything in a living creature is to produce proteins. This is why the blast cells always have large quantities of rough surface endoplasmatic reticulum, and the ribosome on that attract hematoxylin. This is why the cytoplasm is blue. Whatever specificity of the chondroblast are these enclosures, which can be partially electrodense, partially non-electrodense, and these are lipids and carbohydrate particles. The lipids mostly for the energy, it's very energy demanding, the activity of the chondroblast, and partially is raw material, especially carbohydrates, because the product, the proteoglycans, contains a lot of carbohydrates. Whenever the cells produced enough intercellular substance, they retire, they reduce the activity. You can see the nucleus is more dense. We have less but present rough surface endoplasmatic reticulum, but whatever is characteristic to the chondrocytes and chondroblasts, any kind of cartilage cells, is that we have carbohydrate and lipid particles inside the cytoplasm. Usually they're living in pairs. What is the structure of the cartilage? All type of cartilages, what's a general buildup? First of all, we have chondrocytes, which I described in details just before. Here you can see very nicely that usually they like to live in pairs or in triplets. The second components are the fibers. These are collagen fibers, and characteristic of the collagen fibers, the most important feature is that although they are a little bit movable, elastic, but you cannot extend it. Consequently, they behave like a rope in the everyday life. The key components are the proteoglycans. On the proteoglycans, you heard a very detailed lecture before. Let me summarize just the most important parts of it. The backbone of the proteoglycans is a protein. The protein is made of peptide bonds, similar to the other protein, and this makes the framework of the proteoglycans. They have a very rich carbohydrate side chains, which sometimes dividing off, and every single line is a long series of glucose molecule with 1 to 4 binding to each other. Very typical to the cartilage that some of the hydroxyl groups are modified, especially hydroxyl group number 2 is exchanged to amino group, and the carbon atom at the end is burned, oxidized to carboxyl group, or even in the cartilage typically exchanged to sulfate group. Why is that? The main feature, practically only feature, only task of the proteoglycans is to binding water. How it happens? As you study in a kindergarten, water made of 1 oxygen and 2 hydrogen, and the hydrogen is asymmetrically located in the molecule. Consequently, if we see a side, in one side where we have dominantly the hydrogen has a positive charge, the other side where we have mostly the oxygen is negative. This is why they work like little magnets. They attract each other and anything which has a charge. If, let me say, in the proteoglycans with the carboxyl group, which usually easily release hydrogen, consequently gets a negative charge, the water molecule gang up around it with the positive charge, and like it attracts like little magnets and the movability of the water is reduced pretty much. The amino group, just the opposite. They like to pick up another hydrogen. Consequently, they become a positively charged area. And the same water molecule for the other side. The negative side is attracted to that, and also the motility will be reduced, almost made immovable, not completely, but partially. So what is the general structure of the proteoglycans? In the middle, we have a very long molecule named hyaluronic acid. The entire proteoglycan molecule in a cartilage is among the largest molecule in the body. It's over 10 million dalton of molecular weight. To the hyaluronic acid, we have a side chain. These are the so-called aggrecan molecules. Aggrecan molecules, like all the proteoglycans, have a protein backbone. This is what we name the core protein, and it has a link protein which connects these aggrecan molecules to the hyaluronic acid. To the core protein of the aggregans, there will be the carbohydrate side chains. You can see here, as I described in details in the previous picture, a series of glucose molecule in which it has strong negative charge. In most of them, typically, the 6th atom is exchanged to sulfate atom, which makes a very, very strong negative charge. By the way, if you hear these words, chondroitin, sulfate, keratan sulfate, which belong to glucose aminoglycan family, these are the typical parts of the aggrecan molecule. This animation I want to show you, probably you see something similar in the previous lecture, what is the essential things in the cartilage of the proteoglycans. As I mentioned, in a glass of water, the water flows very readily. Even in the glass, the water is different. Many atoms of the similar molecular weight, you know this is 18, even bigger, are gases. But because of this charge, many water molecules attached to each other, consequently they are liquid. If in a vicinity we have slightly charged things, like this is the hydroxyl group of normal sugars, in this case it prevents the working. Partially attached to that, then it slowly goes to the next one, to the next one. And this is why the liquid becomes very difficult to flow. This is the honey. Honey is nothing else, just the concentrated sugar solution, and because of this mild negative charge, makes the water flow slowly. Even stronger charge will also inhibits the movement of the molecules even more, and unfortunately this is stopped. These molecules will not try me again. Maybe it works. No, unfortunately. These molecules will just move away, but it just goes back. So this is whatever makes a substance which is movable but keeps its shape. When I move away, it turns back. This is the jelly. This is in which condition the water is in connective tissues and the cytoplasm, whatever, which forms a kind of jelly. Finally, in the cartilage, the very strong negative charge of the sulfate group prevents the movement of the molecules. Just a very slight movement is allowed, and this is why we have this hard substance. Interestingly enough, 60 to 80% of the cartilage is water. So the hard cartilage is water. Why is that hard? Because the proteoglycans prevents the molecules from moving, make a very little elasticity. The other feature is why the cartilage is that hard is the combination of the proteoglycans and the fibers. As you know, the fibers are not extensible. The proteoglycans, however, like to attack the water. Whenever a water molecule just happens to come in nearby, it becomes trapped and cannot go away. So it actually draws water whenever they can from the environment. However, there is a limit for that, because the collagen fibers which are embedded into this area, not extensible, cannot increase in size, and this is why the proteoglycans with the water start to swell, but the collagen fibers prevent it, and this makes a kind of hard but slightly elastic things. Very similar to the football or any kind of game ball. The covering of this ball is leather, which is very soft if it's not inflated. Whenever we inflate, grows a certain size, further was impossible, like the collagen fibers, and as we blow air into that, like swelling of the cartilage, become more and more hard without increasing the size. So the solidity of the cartilage is due to a kind of balance between the swelling, tendency of swelling, and also to the non-extensible fibers. The other component of the cartilage is glycoproteins. You know, these are a combination of proteins and carbohydrates in which the proteins are dominating. As you studied in details before, this behave like glue in the tissues, and these stick together, as you studied in details, the epithelial cells, for instance, on the surface. Okay, now let's spend a few words on the development of cartilage, how this tissue come into existence in our body. In the embryonic life, like most of the tissue, it's made of stem cells. The stem cells multiply and start differentiating. Mesenchymal cells are there. They differentiate into chondroblast. This is a very, very young cartilage. Every now and then you can see dividing cells like here or here, and the differentiated cells become elongated and start producing proteoglycans. We have some proteoglycans because there is something between the cells. So these are already young chondroblast and stem cells combined. Later on, the way, as I described before, they start producing the intercellular substance, both the fibers and the proteoglycans, and you can see very nicely that this area, for instance, was produced by this pair of cells, and they become further away from each other because they grew. Because in the embryonic life, the cartilage is still soft, they can go from inside. Inside, cells can multiply, and the whole tissue grows. This is the unit, whatever is here is named the chondron. In the children, the cartilage is already solid. It is impossible to grow from inside. The growing is done by the surface. Every single cartilage has a dense collagenous connective tissue at the surface, whatever is named perichondrium. And this is what makes a service function, contains vessels for feeding it. And whenever somebody is young, among the fibrocytes, we have round cells. These are stem cells. Stem cells, similarly as described before, differentiate into chondroblast. Chondroblasts start producing intercellular substance. At the beginning, when they produce a little, they are close to each other. If you go further, move on, they become more and more round and further away from each other because their own product separates the other group of cells. This way, new and new layer of cartilage is deposited on the surface of the cartilage, and this is how it's going. This type of growing, that whenever new layers are positioned to the surface, named appositional growth, and the perichondrium is a key structure controlling that. The feeding of the cartilage is typical. The cartilage does not contain vessels. Consequently, the availability of the oxygen and nutrition is very critical in the cartilage. This is the oxygen, nutrition, and the waste material just mobilized by diffusion. It makes things much more difficult, you know, that the water here is bound. It's very limited movement of the molecules, water molecules. Consequently, there is a limited movement also of the oxygen and nutrition, and there is a very hard life of the cartilage. This is why this is our tissue, our organ, which is degenerating soon. you know, the various organs of the human body become old, becomes destroyed at different ages. Some organs can live for long, some of them not. The earliest degenerating organs are the cartilages. Around 30 years of age, you already feel symptoms of degeneration of the cartilage. How can we prevent this type of degeneration? By mechanical movement. If you make a pressure on the cartilage, you press a little liquid out. When you release this pressure, the liquid draws inside, and as you move a sponge, you can facilitate the diffusion. This is why if you move, walking, doing any kind of job which dynamically changes the pressure on the cartilages, your cartilage will live longer. If you just sit and do not move, do not make alternating pressure on the cartilage, your cartilage will degenerate soon. During degeneration, first of all, the proteoglycans has more sulfate. In this consequence of that, it becomes harder because it binds the water stronger, and this further reduces the diffusion, and this initiates a kind of vicious circle. Whenever during this process the cells do not get enough food and they die, and they stop doing the maintenance job on the fibers. Consequently, the fibers break, destroyed, and the whole cartilage get broken. If the cartilage becomes broken, calcium deposited on that, and finally it rebuilds to bone. It's been named ossification, which actually doesn't fulfill the requirements of the cartilage, but better than nothing. What is the function? The main thing, whatever a cartilage, any kind of cartilage tissue can tolerate, is the pressure. It has a very good resistance against pressure, and we use on that location on the body where resistance against pressure is necessary. Now, after this general introduction, let's see what type of specific cartilages are. In this case, not too many news, I say, but we have a certain composition. Among the three types of cartilage, the hyaline cartilage is one. This is typical in an area that we have chondrocytes, cartilage cells, like all of the cartilages, sometimes alone, but mostly in pairs or triplets. But whatever is important is that between the cells, you cannot see anything. It's a kind of structureless, whitish area like a glass. And this is why it's named hyaline cartilage. In between the cells, we do have fibers, but the fibers are invisible. So the hyaline cartilage, the ground substance, the matrix is dominating, and actually it's in so high quantity that they make the fibers, which is embedded, invisible. These invisible fibers made of collagen II fibrils. Well, this type of the various collagen fibrils, we have altogether 28 as you studied, has absolutely no medical significance, but because some of the examiners like to hear that, at least till the exam, it's better to remember that. How can we visualize these invisible fibers? The number one is a silver impregnation. As you studied in the previous lectures, we have different methods to visualizing components of connective and supportive tissues. One of them was the silver impregnation. This is especially used for seeing reticular fibers, which is stained black in this case. However, both the elastic and the collagen fibers will be stained as a pale brown structure. This is really not useful when we use a general slide, but in the cartilage it's still visible, unlike all the other staining, which is prevented completely by the proteoglycans. This, even in the presence of the proteoglycans, let the fibers stain. Consequently, they appear as a pale brown fibers. The second possibility is as we remove the proteoglycans, there is an enzyme named hyaluronidase which cuts the hyaluronic acid, the backbone of the proteoglycans in the cartilage, little pieces, and we can dissolve this way. Consequently, when the proteoglycans is not present, we can stain the fibers in a usual way. Finally, especially on thin cartilages, when the collagen fibers run parallel, like for instance here, in the surface of the joint, the parallel running fibers is made visible with the polarizing microscope. They turning the plane of the polarized light. I already mentioned briefly the chondron, which is best visible in hyaline cartilage. So chondron is a unit of the hyaline cartilage, which consists of a pair or triplet of cells and an area which is visibly produced by that. The inner area is always paler, it means less acidification, it's close to neutral, and the outer area is strongly blue, it means it's highly acidic, highly sulfated this structure. Territorial structure, or the territorial structure is a general expression showing that we are able to see in a slide that this area belongs to this cell, this area belongs to and produced by these cells, and so on. So every cell has a territory, an area, which is stored. This is what is generally named territorial structure. Where can we find hyaline cartilage? First of all, we can find in the joint surfaces, make it smoother, rib cartilages which connecting the sternum with the end of the rib. And because in the breathing movement, the front end of the cartilage makes a very tricky way. It goes up, goes laterally, and also turns. No joint could compensate for it. This is why we have the cartilage, hyaline cartilage, which has elasticity and compensating for this movement. Also the part of the nasal septum, the anterior part of the nasal septum made of that. Hyaline cartilage forms the wall of the airways. It's a lightweight and slightly elastic things which can very nicely make the wall of all of the airways. The interesting position is the bone primordium. As you will see in one of the next lectures, the bones develop from, most of the bones, from the cartilage bed. First a structure develops from the cartilage and then it will turn to be the bone. And this is also a hyaline cartilage. Believe it or not, this is a fingertip of a human embryo. And this is the first phalanx, second phalanx, and so on. And you can see everything is made of just young hyaline cartilage, which will be turned to be bone later on. Important thing is that in the cartilage we have no vessels, as I mentioned a couple of times. And because there are no vessels, there is no healing process. If we break our hyaline cartilage, it can never cure. Consequently, if we put our nose in the vicinity of a fist, it can get broken, and the cartilage itself can never be cured. Maybe a plastic surgeon can replace the cartilage with someone, but the cartilage is completely went away. Also, we have in the larynx, for instance, if somebody is hit in the larynx and the larynx is broken, practically can never breathe, or just if it's just with some kind of help of metal or artificial things. Also, it's very important not to break, not to cut the rib cartilage during chest surgery. If we cut or break the cartilage, it will get never cured, and the patient has always problem with it. Usually a chest surgery done in a way that it cut the sternum just in the midline, and with a very sophisticated instruments, very carefully, in the protection of the rib cartilage, open up the ribs and doing the operation. After the operation, with a couple of metal clip, the sternum will be joined. In a few days, practically it will be cured. If the cartilage is broken, no help. Okay, next type of cartilage, the second type, is a collagen fibrocartilage. It also contains the three key structures of the cartilage, these cells. the fibers and the proteoglycans. But in this case, there is so much fibers that even in the presence of the proteoglycans, we can see the fibers. The fibers looking strange because they are white, sometimes even bluish, but you can see the shape of the fibers. This collagen fibrocartilage is one of our most durable tissue. It resists against the pressure, like the cartilages, and also it resists against the extension because the collagen fibers, large quantity of collagen fibers, will prevent breaking it. This is a very important pair of slides. On the exam, in my almost 40 years of experience, about 90% of the students fail on this slide. But it's very easy to pass if you pay attention to some very basic things. Here you can compare the collagen connective tissue, dense collagenous connective tissue, and the collagen fibrocartilage. At the first view, both of them has parallel running collagen fibers, and that's common. But we have two differences, and that's what you have to see. The number one is the color of the fiber. The collagen fibers are red, not too strong, but definitely red because of the protein content. The same collagen fibers, if it soaked through with proteoglycans, the proteoglycans prevents the staining of the proteins. Consequently, it becomes unstained, and even whenever the proteoglycans is very acidic, it attracts hepatoxylin and it becomes blue. The other difference is the nuclei. In the collagen connective tissue, we have fibrocytes which has needle-like nuclei. The cytoplasm is not visible because it has the same color as the fibers. The collagen fibrocartilage has chondrocytes, not fibrocytes. The chondrocytes are round, having round nuclei or short oval nuclei, never that needle-like long nucleus, and usually very well visible the white cytoplasm, which is typical to the cell. So if you get a slide which has collagen fibers, two things to check: color of the fibers and the nuclei. If the fibers are red, nucleus needle-like, collagen connective tissue. If the fibers are white, sometimes bluish, and nucleus is red, and moreover you can see a white cytoplasm, this is the collagen fibrocartilage. Where can we find that? As I mentioned, this is one of our most durable tissue. So we utilize this tissue whenever we have a strong mechanical influence, mechanical abuse of the tissue. First of all, it happens in the coarse surface of the joints. Between the bony pieces, sometimes we have complete disc. These are discs like between the vertebrae, or ring-like tissues like meniscuses in the knee joint. Or just a narrow extension of the cavity, which is named a labrum. All of them are made of collagen fibrocartilage. Symphysis also made that. Around the tendons, some of the tendons, strongly used tendons, close to the insertion, also turns to be collagen fibrocartilage. The tendon is basically dense collagenous connective tissue, but whenever it's pretty much abused, it turns to be the more resistant collagen fibrocartilage, and this is the picture what you have. Sometimes we still have red color of the collagen connective tissue, sometimes white color, which already has a certain quantity of the proteoglycans. Nuclei are sometimes elongated. This is still the connective tissue, but many times round. This is the chondrocyte cartilage cells. So this is a kind of mixture of these two tissue. Some of the anatomical component which form socket of the joints, and we name it ligament, is actually not histologically ligaments, not dense collagenous connective tissue, but fibrocartilage. Very typical thing you just studied soon ago. The annular ligament of the radius, ligamentum annulare radii, in which the surface of the joint is not a bone, the socket, but other structure. Even although we name it ligament, this is not connective tissue, but a fibrocartilage. This is what is visible here. The rest of them is real ligaments. We have similar others like the ligamentum transversum atlantis, ligamentum calcaneonaviculara plantare, and a few other locations. So whenever we have connective tissue-like, ligament-like structure forming a surface of a joint, it's always fibrocartilage. The third and last type of the cartilage is the elastic cartilage. As the name says, it contains a lot of fibers between the chondrocytes, which is visible, especially if it's stained with orthene, like this slide. The elastic fibers fundamentally running across, so the right angle to the surface, and as you see, do not reach the large quantity of the fibers, the surface, the significance of which will be described just in a minute. First, I'd like to show you an electron microscopic picture of an elastic cartilage. How do you know that's an elastic cartilage? The elastic cartilage consists of two things, chondrocytes and elastic fibers. Let's see these cells. The typical thing, whatever is typical to the chondrocyte, is that we have many occlusures with lipids and carbohydrates. No other cells has that many, so this is definitely chondrocytes. This little dot around that are the microfibrils, which one component of the elastic fibers, but the most typical is the structureless mucous type of things. If you have an electron microscopic picture which made of non-rottent tissue, the only thing which shows this type of homogeneous area is the elastin from the elastic fibers. So this microfibrils and elastin together shows elastic fibers. So this is why it's an elastic fibrocartilage. If you have to see that on the surface of the elastic fibrocartilage, we have a structure which is not stained strong. This is definitely not elastic connective tissue. Very few elastic fibers are, but dominantly we have a different fibers which is not stained with orthene. These are collagen fibers. This is very important to know that every cartilage type has dense collagenous connective tissue as a perichondrium, independent on what's inside. In the collagen fibrocartilage, which is very difficult to distinguish, usually we don't talk about the perichondrium, even although it exists, but it's very well visible both in the hyaline cartilage and in the elastic. And once again, in elastic cartilage, also dense collagenous connective tissue forms the perichondrium. What is the role? It makes a kind of framework of the body organelles or body parts, which is elastic but keeps its shape like the auricle. So one of the typical occurrence is the auricle, in which if they move, it turns back. Even although it's very rigid, but if we professionally try to destroy somebody's ears, like the wrestlers, you can make such an ear when the hyaline cartilage is completely broken and looks like a pretty much distorted ear. Also the eustachian tube made of that, and the epiglottis. This is a little piece of cartilage what you study in the middle school, which is between the oral cavity and the larynx and prevents the food to get into the larynx. Further details in the next semester. This is what I wanted to talk about to you today, and thank you very much for your attention.